I guess. Hi, everyone. I'm Allison Mahar. I am faculty here in the School of Nursing at Queen's University, and I am going to just be giving a bit of a welcome and introduction to Dr. St. Cyr, who will be the star of the show for today's session. Um, I was going to start just with a land acknowledgement. Um, so are folks able to see my screen? Yeah? Okay, fantastic. Everyone's probably familiar with land acknowledgements, but I just wanted to give a bit of a reminder that they are provided to demonstrate a land respect for the land and acknowledge and honor the First Nations, Inuit, and Métis peoples and communities who were and are stewards of the land. So today's event, of course, is being hosted virtually by Queen's University, but you all may be joining from different areas of the province or other places, depending on where you're working today. So Queen's Campus which is situated on ancestral Anishinaabe and Haudenosaunee territory, includes Grant Hall and Kingston Hall, which were both converted to military hospitals during World War I. So just adding a bit of a theme here relevant to our presentation. So the School of Nursing, of which I'm a part of, was actually initiated in 1941 in part due to wartime needs and demands related to World War II. So Queen's University and Kingston are located on lands included in the Dish with One Spoon Wampum Belt Covenant, an agreement between Anishinaabe and Haudenosaunee peoples, acknowledging their reciprocal responsibilities to live and use resources in a spirit of peace and cooperation. So control of land and resources are key determinants of many local and global conflicts involving Canadian and other military, as well as the rationale for colonization historically and in the present. The use of the military as a tool in current and historical conflicts as a form of oppression of Indigenous folks, including direct conflict between representatives of Canada and Indigenous peoples and communities, is quite well documented. Of course, First Nations, Inuit, and Métis folks do serve in the military and have for a long time, and this is now acknowledged with an Indigenous Veterans Day to honor the contributions of First Nations, Métis, and Inuit military members and their families, both in current and historical military activities. But the land and resources across the country, in many cases, remain stolen, misappropriated, or misused. So considering the military's role in colonization, past and present, is important in working toward reconciliation. So thank you for the opportunity to share that as we get started on our session today. And oh, there's my stop share button. So now I have the distinct pleasure and privilege of welcoming Dr. Kate St. Cyr. So Dr. St. Cyr is a postdoctoral research associate working at Queen's University in connection with the Garnet Families Partnership, which is a SSHRC-funded partnership focused on enhancing the research ecosystem for defense and public safety sector families. Dr. St. Cyr completed a PhD in epidemiology at the Dalla Lana School of Public Health at the University of Toronto. Dr. St. Cyr is currently leading a study funded by the Joint Federal Research Funding Program for Military Personnel and Veterans, and sponsored by the Department of National Defense Gender and Diversity Health uh, sector. So this focused on gender, occupational stress, and mental health among active members of the Canadian Armed Forces. So with that, Kate, please do take it away.
Super, thanks. Okay, I'm just gonna get it set up. Thank you for the land acknowledgement. Also, Allison, there's like so much to reflect on in there. Um, it was really impactful. Um, okay, let's see. Okay, everyone can see the slides okay? Super, excellent. Okay, so thank you all for carving out a little bit of time in your day to join me. I'm going to be sharing with you some of the preliminary work that we've been doing to look at the impact of occupational stress on mental health outcomes in the Canadian Armed Forces. And as Allison mentioned, this work is being conducted for the Department of Women and Diversity Health. So we take a sex stratified approach to this work. There we go. Okay. I'd like to acknowledge the really fabulous research team who's been involved in the work so far. We also have an advisory group of female veterans who have been helping to guide our work and ensure that it's relevant and accurate in our interpretations of our findings. So a huge thank you to them for all of their contributions to date. And I'm also not going to stumble over the wordy funding source, but an acknowledgement to them for their support in conducting this work. So some of this has been covered. A little bit about myself. So as Allison mentioned, I completed my PhD at the University of Toronto in 2024. So still fairly fresh, 2024, 2023. I don't even know anymore. Prior to that, I worked as a researcher and a program evaluation support officer at one of 10 Veterans Affairs Canada funded outpatient mental health clinics. And these clinics were designed specifically to support Canadian Armed Forces and Royal Canadian Mounted Police members, veterans, and their families. So I don't have a close personal or family connection to the military, but I've been working with this population for just over 15 years now. A quick agenda for today. So again, this is work in progress. So I think the presentation should be fairly brief-ish. I'm going to start with giving a bit of a background about the CAF before moving into a tiny introduction to occupational stress and its association with mental health outcomes. We'll go into the study objectives, and then from there, just sort of follow the standard methods, results, and next steps. Okay, so a bit about the CAF. It's organized into three branches, the Army, the Royal Canadian Navy, and the Royal Canadian Air Force. And individuals can also serve in the forces through the Special Forces, the Rangers, and the Cadets. There are currently about 68,000 individuals employed in the regular force and an additional 27,000 employed in the reserve force. And so the regular force, or the Reg F, as you'll see on the screen, consists of individuals who are employed in a permanent full-time capacity. These individuals are operational, which means they can be deployed. And this would be their sort of full-time regular job. The reserve force is broken down into three different classes. There's Class A, Class B, and Class C. And Class A and B are more of a part-time in a casual role. So this could be working one day a week, one weekend a month. And then Class C reservists serve in a more full-time capacity, and they are operational, but this would be on a voluntary basis. The CAF serves a number of core functions, so to defend Canada and North America against threats, to contribute to NATO missions, to contribute to international peace operations. They're involved in search and rescue operations. They provide assistance with domestic and international disasters. And some recent-ish examples include the Quebec ice storms, 1997, and the earthquake in Haiti. And they provide local assistance with national security and the security of Canadians abroad. This map, it's kind of tiny, shows the distribution of CAF bases across Canada. I'm going to just focus very quickly on Ontario because that's where I'm situated. So Ontario is home to 8 bases, as well as the Department of National Defence headquarters and the Royal Military College right there in Kingston. Um, and the there's really tiny percentages there. The area around Kingston is home to a significant percentage of CAF members. Again, partly due to the density in terms of bases close by and the Royal Military College. On your screen, you'll see a timeline of select Canadian Armed Forces missions. So these are some of the more notable missions that the CAF has been involved with in recent history. There are blue dots and green dots. The blue dots represent combat missions, and the green dots represent peacekeeping or humanitarian aid missions. So from about 1960 onward, the forces were really involved primarily in peacekeeping and humanitarian aid. And then this changed in the early 2000s when the CAF became involved in the military conflict in Afghanistan in a combat role. And so the experiences of individuals who served during that Afghanistan era are probably slightly different than the occupational experiences of someone who served in the early 1990s and was deployed to Rwanda. Flipping to occupational stress. Across a range of occupations, occupational stress has been associated with burnout, mental health conditions, insomnia or other sleep disruptions, digestive issues, physical injuries, hypertension, and family discord. And this may be particularly true in military and public safety sector occupations, where individuals have a number of unique occupational exposures, and these can be environmental, physical, or psychological in nature. Further to that, individuals serving in the CAF experience a number of lifestyle components related to their work in public safety. And so these include things like deployments or postings away from home, and shift work and complicated schedules, and then a bit of a spillover impact on the family. Um, the stress involved at work, being deployed away from home, the impact on families is quite notable and perhaps different than what we see in other occupations. Even within the CAF, males and females may have different experiences. So males represent about 85% of the CAF. They are able to serve in any occupation. And compared to females, they are more likely to report hearing problems and less likely to report joint pain and repetitive strain injuries. It wasn't until 2001 that females could serve in any role in the military. They are more likely to experience military sexual trauma than their male counterparts. They may experience increased pressure to fit into a historically masculinized environment. And there's some evidence to suggest that women in military occupations report increased difficulty with work-life balance. So, what do we know about the mental health outcomes of individuals in military and policing occupations? There are higher rates of mental health disorders amongst individuals compared to the Canadian general population, and this is actually consistent across other nations as well. A survey from 2013, so getting a little bit dated, but I think still relevant, found that about 16.5% of CAF members met past year screening criteria for one of six common mental health disorders. And a similar survey conducted amongst members of the Canadian general population around the same time found that about 10% of Canadians met past year screening criteria for one mental health disorder. So a slightly higher percentage of individuals in the CAF. There is some evidence showing an association between occupational exposure to potentially psychologically traumatic events and mental health disorders amongst military populations, but less is known or it's been less widely studied, looking at the association between those sort of daily occupational stressors and mental health disorders amongst CAP members. So that brings us to the objectives of this work. We aimed to describe and contrast the sex-specific occupational experiences and sources of work stress amongst CAP members, and then to investigate the influence of occupational stress we looked at three different types of mental health disorders. We had anxiety disorders, mood disorders, and post-traumatic stress disorder, and we stratified this analysis by sex. So as I mentioned, we had an advisory group who was involved in some of this work, and the aim of the advisory group was to ensure that this work was relevant to contemporary CAF members and veterans, to bring their lived experiences to help with the interpretations of our findings, and to help generate actionable and culturally appropriate recommendations to help improve the health and well-being of CAF members and veterans. And so again, this is still a work in progress. The advisory group members were involved in aims 1 and 2 today, and we're still working on aim 3. For this work, we used the 2019 Canadian Armed Forces Health Survey. This was a cross-sectional survey that was conducted by Statistics Canada between January and June of 2019. It used a stratified random sample of regular force and Class A, B, and C of reserve force members. The strata for Reg Force members were CAF base, age group, and sex, and then slightly different for Reserve Force members, where the strata were province, age group, and sex. There are a number of stress-related variables in this survey. So there is a question about sources of daily stress and some of the options that individuals could include. So like the wording of the question was, what is the biggest source of stress in your daily life? And the response options included things like work, finances, health, family, school. There are two questions about ability to cope with stressors. One is how well do you cope with day-to-day stress? And responses include or use a Likert type scale and range from very well to not so very well. And then there's a similar question asking respondents how well they deal with a crisis type situation. And then there are a couple of variables that could be used to sort of tease out occupational stress. So specific to military, there are questions about were you deployed? If so, were you deployed outside of North America? Did you experience an injury during your yearly force evaluation test? And then there is a module that includes a modified version of the job content questionnaire, and that's going to be the focus of the work that I share today. So the job content questionnaire is broken down. There's an item about job insecurity. There's an item about workplace social support. There's one about social support from peers and one about social support from supervisors. There are questions about the level of physical exertion required to do your job. And then there are questions that we used to create kind of a variable to describe workplace psychosocial environment. So I'm going to call that job strain. And this is what I'm going to focus on for the presentation today. So job strain was assessed using two subscales, one called decision authority and one called psychological demands. The decision authority subscale included two questions. So your job allowed you the freedom to decide how you did your job, and you had a lot to say about what happened in your job. The psychological demand subscale also included two questions. Your job was very hectic, and you were free from conflicting demands that others made. I should note that for all of the questions in the job content questionnaire, individuals were asked to think about their main job in the CAF in the past 12 months when they were responding to these questions. So we took these items, we estimated the mean value or the median value for each subscale total, and then created a 4-category variable to measure job strain. And this is based on work that had been done using a similar modified version of the job content questionnaire in other Statistics Canada administered surveys. So this is what our job strain variable looks like. We have 4 categories, so active, high strain, low strain, and passive. And individuals who scored above the median on both the psychological demands and decision authority subscales were said to be in an active work environment. Individuals who reported high demands and low decision authority were in a high strain work environment. If we flip it, individuals who had low psychological demands and high decision authority were in a low strain environment, and individuals with low demands and low decision authority were said to be in a passive work environment. We have some mental health related variables, and so these were the exposure variables of interest in this work. Individuals were asked to self-report whether they had an anxiety disorder, a mood disorder, or a post-traumatic stress disorder. And then there's also a question that asked about past 12-month mental health service use. So in the past 12 months, have you talked to a health professional about your problems with emotions, mental health, or use of alcohol or drugs? For our analyses, we conducted 3 separate sex-stratified adjusted logistic regression models. So one for each of those mental health outcome variables. We adjusted for a number of sociodemographic and military-related variables, so age, marital status, highest level of education, knowledge of official languages, the presence of children in the home, as well as the presence of adults over the age of 70 in the home. And then force type, so reg force versus reserve force, environments, so this is Army, Navy, or Air Force, rank, and length of service in years. Okay, well, Something's out of order there. We had a weighted total of just over 56,000 regular force members, and about 14.5% of those individuals were female, and then just over 20,000 reserve force members, and about 16% of those were female. Compared to males, females in the regular force were on average older, more likely to speak both English and French, more likely to have at least some post-secondary education, more likely to be a junior or senior non-commissioned member, and less likely to serve in the Army. And when we compared males and females in the reserve force, we saw very similar patterns, with the exception of being more likely to be a junior or senior non-commissioned member. Okay, when we looked at how job strain was distributed amongst males and females by force type. Um, Females in the reg force and males in the reg force, a higher proportion of these individuals fell into the active or high strain categories. And then when we look at the reserve force members, both males and females, a slightly higher percentage fell into the low strain and the passive categories. In terms of the other potential occupational stress variables, so individuals employed in the regular force, both males and females, reported really low rates of feeling as though they had job insecurity, so about 3%. Individuals, both male and female, in the reserve force reported a higher percentage reported some job insecurity, and that's likely tied to the less permanent nature of employment in the reserve force. So they would complete contracts, and then once those contracts were set to expire, they would either extend or not. When we looked at jobs that required physical exertion across both reserve force and reg force, males reported, a higher percentage of males reported having physically demanding jobs compared to females. And then the final question looked at low social support. So across the board here, small percentages of both males and females in the reg force and the reserve force reported experiencing low social support at work. In terms of mental health disorders, about 17% of females in the reg force reported having anxiety or mood disorders. Individuals could certainly report that they had one or both or all three. So these categories are not mutually exclusive. Um, Similar patterns were seen for anxiety and mood disorders, and then PTSD was slightly different. So, similar percentages of male and females in the reg force reported having PTSD, and this percentage was slightly higher than what was reported by males and females in the reserve force. The question about past year mental health care seeking. So again, this was, have you sought mental health care from any health professional in the past year? So almost 40% of females in the reg forces reported seeking mental health care. This is quite a bit higher than either females in the reserve force or males in either the reg or the reserve forces. And we will come back to potential explanations for that shortly. This table shows the result of the logistic regression models. So these are the adjusted odds ratios. The first column shows for males. And so across the board, males in an active, a high strain, or a low strain job environment had a higher adjusted odds of anxiety disorders, mood disorders, and PTSD relative to individuals who fell into that passive job category. So that was like fairly neat and clean, and all of those findings were statistically significant. When we looked at females, The impact of psychosocial work environment was less clear. Um, so individuals in a active work environment, or sorry, females in an active work environment had a higher odds of a mood disorder or PTSD than individuals in a passive work environment. But psychosocial work environment didn't seem to impact the likelihood of anxiety disorders very consistently amongst females. Okay, so to summarize key findings, so across both reg force and the reserve force, females were more likely to report past year engagement with a mental health professional than males. Females were also more likely to disclose mood or anxiety disorders than males. Job strain was consistently associated with anxiety disorders, mood disorders, and PTSD amongst males, but not females. And among females, being in a high job strain environment was associated with equal or lower odds of disclosing mental health conditions compared to a passive psychosocial work environment. This work has some limitations. So the survey that we used included, we used the sex variable rather than gender variable. And this was due to some issues in how we felt about how the gender variable was collected and reported in the survey. And we know from previous work that gender is an important determinant of healthcare seeking behavior. So using sex wasn't quite ideal, but we felt that it was more appropriate to look at biologic sex versus sociocultural gender just because of the way it was operationalized in the survey. The survey is a bit dated, so conducted in 2019. We're not entirely certain if it's still reflective of CAF members' experiences to date. The questions about job strain focused on the respondent's main job in the CAF during the past 12 months. And our advisory group members informed us that this maybe wasn't, there weren't capturing enough nuance here. So the women in our group really felt that your psychosocial work environment depended on so much more that could fluctuate on a daily or weekly basis. So, what shift are you working? Who are you working with? Who's your supervisor? And this was not consistent, and people's jobs also changed during that period of time. So we're maybe not capturing sort of the full experience. The survey is cross-sectional in nature, so we can't make any sort of detailed inferences about the causality. And the small cell size is limited, making some comparisons by force type and sex. So again, some of the advisory council members really felt that we needed to look at reserve class members independently of one another versus lumping them all in together, given that there are almost certainly differences in the occupational experiences and exposures of someone who's working in a voluntary part-time role versus individuals where this is your permanent full-time job. And there's been, I think, lots of ongoing debate about whether self-reported surveys are subject to underreporting or social desirability bias. So something to keep in mind here. In terms of implications and next steps, I think the key implication of this work was just highlighting the importance of conducting sex stratified analyses. So they weren't presented in this study, but we did look at comparisons sort of overall by just force type. And when we do that, we miss the differences that females who represent a smaller group of CAF members contribute to this to our knowledge. So really important to separate out males and females in military health research. In terms of some potential next steps, we'd like to explore the influence of decision latitude on the point estimates. I think it'd be interesting to see whether, if we kind of try to isolate how much control individuals feel that they have over their work environment, if that helps influence the association with mental health disorders. We'd also like to explore different measures of stress within the CAF health survey. So perhaps repeating the analyses using the measure of day-to-day stress levels instead of the job strain variable. Considering specific occupational experiences and interactions. So looking more closely at deployment history, interactions between sex and presence of the children in the home, and then again, further stratification by the reserve force classes. Finally, our advisory group really would like to see us augment this work with qualitative interviews, which would allow us to perhaps delve deeper into some of the specific occupational stressors that women in the CAF experience. And that is it for me. See, stop sharing.
Was
Um,
great, Kate. Thank you very much. It's so lovely to see that work put into kind of the context you've provided, as well as kind of seeing it all together again. So thank you. I think at this point there's time for questions from folks. So I'm happy to help moderate any questions people may have, or if you want to put them in the chat or raise your hand, and we can unmute and have a conversation. Oh, Catherine.
Well, I always like a good question to get us going. Thanks, Kate, for presenting. That was quite interesting. And I came a little bit late, so I apologize. So I'm going to ask more of a clarification question for myself. Really interesting work, by the way. Um, my very first, I didn't work with individuals in the military, but definitely, it's when I first started working, we didn't acknowledge psychosocial issues in the workforce. You would only be able to be off work for physical injuries. So I think things have come so far in my work time. When you said active versus passive, do you mind just clarifying that for me? Just because, like, in my mind, maybe it's just the terminology because I see active as like a positive versus passive not. And so maybe it's just the classification.
Yeah. So we actually borrowed the classification from some other work that had been done. And the study is going to escape me now, but it was using another StatsCan survey that used this modified job content questionnaire. So we really just borrowed heavily from that work for consistency's sake. Um, I agree that in a workplace like the military, I would think that an active environment is a good thing. You're being challenged, but you have some control over your work. It does kind of sound like, like an ideal or what you would expect work in a military environment to be like. Um, the passive work environment, and I've tried to give some thought as to maybe what types of roles this could be. Um, and I don't, it's tricky to do, I think, without speculating. Um, I suspect there's probably, I think, some sort of correlation with rank. And I would think that individuals who are lower ranking are less likely to have obviously some control over their job or the decisions that need to be made in their job. Um, I am trying to think of a job within the CAF that might not be psychologically demanding, and I can't. Like I think that it's probably all stressful, and I think maybe some of that boils down to less so specific occupational role and more so personality. If you're like a really strong, resilient go-getter, you might go into work and be like, yeah, like it's great. It's not stressful. It's fine. It's just work. Um, But your point about kind of the positive and the negative sounding roles is certainly taken, and maybe we need to revisit what else we could potentially name it as I mean, we could go back and just call it low demand, low low decision authority, and that might be less misleading.
Yeah, actually, that's a really interesting point. I just think because nowadays we think of active and passive, like I think. some of us might see one of those as good or bad, like it just kind of depending on your context. I thought it was interesting also the gender differences, and you had mentioned that your advisory group gave you a lot of ideas to think about, like contextual factors, and were they specifically female people on your
Yeah.
advisory
Yeah,
group?
so it's they're just female, or not just female, they're all female.
Mm-mm.
Um, and they had some really really passionate people, really interesting insights. Um, yeah, they felt they had mixed feelings about what we
Mm.
saw in terms of the modeling. So I think with the anxiety disorder, one in particular, where the reference group was individuals in the passive work environment, and um, if you were in any other category of psychosocial work environment, there was not a significant association, or I guess like a significant association such that higher strain wasn't necessarily associated with a higher risk of a mental health disorder. Um, and some of the advisor group members felt that this was because, you couldn't. Um, pardon me, you just couldn't. You couldn't own that you were not feeling great, that you were feeling stressed. Um, we had wondered if perhaps it was because of like a selection bias. So if you were, you know, maybe more likely to be predisposed to an anxiety disorder, you were less likely to carry on that role. So you've already been selected out of the military. You're not even making it into this survey. They didn't like that. Um, they thought that was definitely not the reason. They thought it was more so that you absolutely didn't want to report that you were experiencing anxiety. The other thing that we had suggested was maybe that it just doesn't matter what type of work environment you're in. As a woman in the military, that doesn't affect your likelihood of disclosing an anxiety disorder. Um, and they thought, yeah, maybe, but it wasn't,
Mm.
that idea wasn't really a hit with them either. So I think more work to be done
Yeah,
on
well, I
that.
always like a good study that leads you to more work.
That has done this.
Yeah, that's wonderful. It's great. Thank you.
Thanks.
Thanks for that question. Kate, I see there's a question in the chat around whether there are any data available on longer term outcomes after leaving service or after leaving more active service.
Yeah, not in this survey. Um, I think it sounds like the CAF has taken back over this survey. They're going to administer the next iteration themselves. Um, pardon me, there's something in my throat. And I think they may be more set up to look at some of those longer term outcomes, or potentially how shifts in, from role to role, if those occur, might be incorporated. Sorry, I'm just going to grab a sip of water.
Sure. If if I could maybe just add to that, Kate, while you're having a drink of water, I mean, I think as you mentioned, because this survey is only on active members, it is really limited in terms of what inference can be made as to the effect moving like after someone has left that occupation. But as you're saying, the having it come back in-house, it may provide opportunities to follow individuals longitudinally, which I don't think you could do with the StatsCan version of the survey. And so looking at how job changes may or may not follow reported mental health symptoms, and the opposite, how changing a job may impact the symptoms you report. But there's also maybe opportunities to link with CIHI data with other national data sets to kind of explore long-term outcomes for folks who were, consistently, for example, report being in higher stress positions, and what that might mean for their long-term mental health.
Yeah, thanks. I was going to say, I do think that this is one that is linkable to the 2002 Canadian Forces supplement of the Canadian Community Health Survey. Um, but I think we'd like to see what's happening more currently versus what happened in the past. I think so some of that work I think has been done, linking the two and looking at differences between 2002 and 2019. But again, that's just the subset of individuals who are still in the forces at that time. And I think it might actually not be the survey, it might be the mental health one specifically, now that I'm thinking about it.
That's great. Anyone else have a question? I have one that I could ask, but I'll wait and see.
I'll ask
Anyone
one
else?
after you, Allison.
Oh no, you please.
I've got a treasure trove of questions.
Oh no, I ask Kate questions all the time. So if you have something that we haven't already been thinking
No,
about.
I don't. I don't know anything. That's why my questions are very naive. So I'm keen to hear yours too.
Okay,
Uh,
well,
I was just
well,
thinking,
go for it. Yeah.
were you surprised at the low percentage of people who reported PTSD? Or and I guess that's
Um,
the other thing is I don't know enough these the prevalence of those of anxiety and PTSD across like the general population. How does that compare?
Yeah, I think so the the like the prevalence of PTSD in military populations is higher than the Canadian general population. It still is lower than what we see for mood or anxiety disorders. And I think in this particular survey, so I wasn't taken aback by the lower percentage here. I think from some of my other work and more qualitative work with veterans, they often don't realize that it's PTSD until quite some time later. And I think often that's after they leave the forces. So I think to the wording of this question was a bit vague. So it didn't ask whether anyone had been diagnosed or was receiving treatment. It was just, do you have one of these? And I think given that PTSD is considered an anxiety disorder, I don't know if I mean anecdotally from my time at the clinic, we would have sometimes people coming in thinking it was an anxiety disorder, and then they would have their assessment, and then it would turn out that it's actually full-blown PTSD. It's not just social anxiety. It's not just general anxiety anymore. So I do think some of that lower percentage that we're seeing here could be related to just like lack of awareness about what PTSD is and how it can manifest. And it can manifest differently, in men versus women. And maybe that's contributing to it a bit, but the prevalence of PTSD still is lower than mood or anxiety disorders in this population. So I think reflective
Thanks for that.
there.
Yeah, I want to follow up on that question, Kate, like, 'cause that's an interesting reflection. Do you think at all kind of a reporting issue might be happening here where folks are still employed and may have concerns about losing their position in particular with respect to PTSD?
Yeah, there's a question in the survey we really do need to look at where they ask specifically, do you think disclosing a mental health condition will put your career at risk? So we should probably look at that. Again, sort of anecdotally from my time working in a clinic with this population, the CAF has done a lot of work recently to try to destigmatize mental health. There's a lot of, you're told like get help. It's not career ending. We're going to work through it with you. Um, and then sometimes it does end up being career ending. And so I do absolutely think there's a bit of a risk to disclose. I think individuals are told when they complete the survey, it's not going to be linked back to your health records. No one is going to, set up an HR meeting after this. But I think that certainly there's probably oh my gosh, suspicion there, and some hesitancy to report because of concerns about career implications.
Mhm.
Yeah.
Yeah, and so Catherine's added another question here to the chat, just about what variables you accounted for in your models.
Yeah. So we do have rank. It's a four category variable. So, not broken all the way down, but so there are junior and senior non-commissioned members, and then junior and senior officers are the four categories that are included there. And that was one of the things that the advisory group really wanted to see more work done was around how rank plays into all of this.
Yeah.
Yeah, that's why I just wanted to follow up about rank and how you accounted for it because
Yeah.
so they wanted more of a expanded scale. Is that what they're
No, they
suggesting?
want more stratification by rank instead of
Okay,
controlling
interesting.
for it in the analysis. They
Oh,
want to see
interesting.
kind of how it shakes out a bit more. Yeah.
And are you planning to do that?
I don't know that we can numbers wise,
Mhm.
just because the numbers of females get small and I discovered in working with the StatsCan data, they even if you only want to report the weighted numbers, the unweighted numbers really matter in what they will allow you to work with. So we will try to do a little bit more work um, around, yeah, some stratification of the descriptives at least by rank, but I'm not sure that we're going to be able to go quite as deep as they may like.
It's so important, especially when you think about power dynamics and how they play out in such a hierarchical workplace environment, and then with the kind of the masculine workplace environment, and then you layer on like how stressful is your job and how much control do you feel like you have over your day to day. You can imagine there being some important stuff happening there, but maybe not that you can explore in this study. Definitely has to be a stopping point at
Yeah.
some point.
Yeah,
For sure.
I think definitely too, working with the advisory group, they want to be heard. Like they would love a nice in-depth qualitative,
Mhm.
supplementary piece of work to this because I think across the board of the women that I was working with, they did feel like the demands on women to keep up were so much higher than men, and they truly felt like they couldn't acknowledge any sort of struggles because they were already at a disadvantage being in this environment.
Yeah, that's so important. Yeah, absolutely, Catherine. I totally agree that having the advisory group has been such a great experience for everyone, but also importantly for the work that Kate that you're doing. Um, okay. I don't know if this typically goes right to 1 o'clock. Like I could keep asking questions, or if folks would love, we were talking at the beginning about how all these Zoom meetings are now booked back to back, and maybe folks would like 10 minutes to prepare for their next meeting. So maybe what I would just say is I'm just continuing on. Like, Catherine, you feel free to step in and close this session if you would prefer. No.
This is great. I didn't want to like make everyone go to the end. It just I love always my favorite part of these is the conversation at the end. So this is great. Thank you. Um,
Yeah. No, this was awesome. Thank you, Kate.